All right, so welcome to the Actions on Claims Appeals. Now, this is part of some information that we do that talks about what happens on different claims. This webinar is about an hour long. It is not designed to go over individual appeals that you may be seeking. Instead, it's designed to go over the general appeals information. So there's going to be a lot going on with this webinar. My name is Tom Ryan. I'm with Provider Outreach and Education. I'll be your presenter today. Today, I'm also joined by Karen Curtis. She's on my team and also one of my friends. And what she's going to do is help with that chat, give me the questions, whatever you want to put in there. As I just said, questions will be taken in the chat, so you want to make sure you're aware of that. So a couple of housekeeping things. One, the presentation is available for you right now to download. This is in our training center under live events in the training material area. Keep in mind, it will be available till the end of the day today. After that, you do have to wait for us to post this into the Encore presentation portion. So the presentation will still be there and you can still get it. You just have to wait a week or so. We'll post it into Encore with the presentation again. During that time frame, it'll be available for 60 to 90 days. The Encore itself will be posted into YouTube and will be available for you in YouTube. Remember to send all the questions in chat. We already talked about that. And also, hey, afterwards, please take the advantage or take the opportunity to tell us how we did. Tell us what you liked about it, what you didn't like about it, all of those different things. I'm going to call it my good, my bad, and my ugly. What did I do well? What didn't I do well? And did you like my PowerPoint? Was it ugly? Was it good? What did you like about it? So just help me understand any of those types of things. The next thing that we want to talk about briefly is just a disclaimer. The information in this material is just a tool to assist you. The official information is on the CMS website. There is a link if you have this slide downloaded. Otherwise, it's just cms.gov. Reasons that we do put it that way is that Medicare information can change, and you want to make sure you're always following the most current information. It's pretty important to make sure that you have that. Now, I will tell you, the appeals basic information doesn't change often, but there are certain pieces that will, and we'll talk about that. It's called the amount of controversy, or AIC, and we'll talk more about that. I did verify the information is correct. One thing that came up is there were some pre-submitted questions. I'm going to try to answer those as we go through. I'll try to call those out and highlight those. But something I want you to be aware of with the pre-submitted questions, I can only answer them to the best of my ability and based on what you gave. So if you pre-submitted a question and you're thinking, he didn't really do what I needed him to do with that, and I need a bit more, please the opportunity to add that back into chat. Now, I was made also that there's some technical difficulties going on and that I'm a little choppy at times. I can apologize for that right out front. So if you miss something, go ahead, put it back in chat and Karen can stop me and I can repeat it at that time. I don't want to go on if you've missed something. So please make sure that you're taking the opportunity to do that as well. It is very important that I get you all the information you need. All right, let's get started here on the next slide with the agenda. So our goal is to increase your knowledge with the Medicare appeals process. Hopefully this will help you get your appeals processed right away the first time. With that, we will start with some appeals basics. We're going to talk about some level 1 issues and tips. Level 1 is the only level that we process. So that's where I get my data from when we talk about level 1. Also, I do want to show you some different resources or provide you with different resources. Now, I will tell you, this is one area that you'll have a lot of links throughout the presentation. I may not take you out and show you all of the different resources due to time constraints, and I want to make sure I get to your questions. So the basics. Why did we start with the basics? And again, this first section is really designed to provide the general information to get you that general understanding that you wanted. But I wanted to let you know that people ask a lot of questions, and the questions lead from simple to complex. Let me give you a few examples here of the types of questions that were asked. Let us to put the basics into this. 1, how does the appeals process work? Well, that's a pretty basic question, and we want to make sure that that person who's new gets that general information. 2, order of the appeals. What to do next? Well, again, that's what we're here to cover, and that's going to be some of the tips. When to appeal and when to replace a claim. So also when to do a second submission. We'll talk about that. Can we get some general overview information? What to learn they just want to learn more about the appeals process because they're new, or some basics. So these are the types of questions that I want to address first. Now, I did summarize a bunch of them into a lot of different things there, so please don't think that I am missing anyone's questions. I just put some basic ones in there, and there were a lot more than that. So when we start with the basics, the first thing I'd like to do is provide you with a definition. And a definition of an appeal is an action any party that is part of the initial determination takes if they disagree with the coverage. Well, that's a lot. And you're like, wait a minute, or payments of a Medicare decision. So an appeal is done on two different forms. We talk about a claim determination appeal. This is probably going to be the one you're most familiar with, but you can also appeal an overpayment request. And this is why some of the parties that are involved can be involved. And I'll explain that in just a little bit. But it means that if you disagree with us taking money back or how we processed a claim, then there are certain times you will have rights. And that right is to ask for us to look at it again. Now it starts at level 1, which is us, and then works its way through 5 levels. And we'll talk about the other levels in just a little while. So really the definition starts with that. Parties to this type of information are 1, coverage for healthcare service and items for prescription drug. This can be appealed. We don't agree that we cover it. Well, we don't agree because it's not coming up as medically necessary. Well, that makes sense. How about the payment amount? So you disagree with the amount you're getting paid, or the patient disagrees with it. That's very common. Also, the patient can pretty much appeal anything they want. And I do want to make that very clear. Sometimes patients will do appeals and you're like, where'd this come from? Why am I getting a letter? We'll talk more about that in a little while. Also, whether it's MA or traditional Medicare, should stop paying, or the healthcare provider supplier items for prescription drugs. So what's going on with all of these different plans? Now, I did mention MA, which is Medicare Advantage or Part C. And each one of those plans has its unique options. I also mentioned prescription drug. This is Part D, and they all have appeal rights. During this course, we will focus on Part A and B, or traditional fee-for-service Medicare appeals, because that's the contract I work under. So any type of appeal will have to go back and based on the claims processor that's doing it to start with, and we'll talk more about that. I did receive a question, and we built this one in to help identify this question. The question is, why was the primary insurance allowed to appeal a claim? We received a letter on this. This brings us to who can appeal and why they can appeal. So a primary insurance cannot appeal a claim themselves. They can appeal, though, an overpayment. Remember, there's 2 types. So I think this provider meant that I hope this provider meant that the primary insurance was appealing an overpayment. So how does that work? Well, a patient can, right? A patient, it's their right. They're going to have a deductible. They're going to have a co-insurance. They may have a copay. So as long as there's something going on, it's their benefit, and they always have the right to appeal. Providers are suppliers who receive payment. You may want to make a little note on that, who receive payment. So if it's a non-participating hospital, they do not have appeal rights. They did not receive payments. Same thing, if it's an opt-out provider for Medicare Part B, which is a professional provider, they cannot appeal. If it's a provider who says, I don't want to accept the assignment of benefits on that, they again cannot appeal. There's certain things that you must be able to do, and one of the involved. File a claim, do you have a right to file an appeal? Well, now this is the one that comes in and that the question is specifically directed at. And it's other parties with financial interest. Well, what that means and what we're saying with that portion of it is so that other people can be responsible for paying Medicare back money that was paid to a provider. In most cases, this will be someone who should be responsible for paying a claim, such as your primary payer. So the patient falls at a store, there's a liability insurance possibly kicking in, or the store itself may cover that. Once final determinations and legal matters are settled, they can actually pay back versus the provider. And that's where that other party came in. Now, here's what does have to happen. When another party or a patient requests it, the provider will be notified that there is something going on. So it's not necessarily that you need to do certain things or there are actions to take. Keep in mind, if that letter does ask you for medical records or other information, you are still responsible for making sure that that does occur. Okay. So I wanted to make that as clear as possible and hopefully answer that question. If you want more information on that, please, please, please go ahead and put that back in chat for me. We will get you some more on that piece of information. All right, let's move on to our next slide. And our next slide says, what else could we do? So we can process the appeal. We can consider it. We can look at it. Now we may uphold it, which is one form of a decision. We may overturn it or partially overturn it, which means we found in favor of you. If we partially overturn, it means part of it we agree with and part of it we don't. But we may also dismiss it. Now, dismissal is something that Medicare does when we don't agree that this is an appeal situation, or you didn't file it properly. It didn't get filed within the right amount of time. So there's a variety of things that can happen. First, you're not a party to the appeal. We do receive appeals without appointment of representative forms, and this person is not party to that appeal. You're not the patient. You're not the Medicare beneficiary. You're not part of the provider representative community. We don't know where this appeal came from. That would be dismissed. We receive requests to withdraw an appeal, and so we can do that as well, and that will be considered a dismissal. Each level of appeal has a certain time frame. Remember, I said there's 5 levels. So we're going to look at that. We'll talk about those time frames. But if you're outside that time frame, you must then justify that. Otherwise, we will dismiss it. Last, it's just not an appealable issue. How do you know that it's not an appealable issue? The best way is to look at your remittance advice. You are looking for an MA01 on a claim. Without the MA01, in most cases, appeal rights are not granted. Okay, so MA01. Now, keep in mind what types of things would not be appealable. And this was a question that was asked if I could give some examples of that. So let me just do that next. And on the next slide, it's going to provide you with a list of some of them. Now, keep in mind, there's a lot more that goes into this than just this list. Karen, did the slide change for you guys? Does it say not appealable now?
It does say not appealable, Tom. You're good.
Okay. I apologize, everybody. A little technical difficulty. It didn't want to do anything for me. So these are some items that are not appealable. So the section of the Social Security Act that states that it has to be medically necessary would be 1862 A1A. But it also says that it must be within the realm and not otherwise exempt from coverage. So anything excluded from the law, the Social Security Act is where we're going to start with. So if it was in 1861 and said we don't cover this, or we have to have these restrictions to cover this, that would be excluded from the law. There are claims that do not contain enough information. And a lot of people ask why we have 2 different types of claims listed here. It says or in the middle of them. And it's because we have 2 different processing systems. So for instance, if you submit on a 1500 or an 837P professional transaction, you get an unprocessable. You must submit a brand new claim. On the other hand, if you submit on a UB04 or 837I institutional transaction, you get what's called a return to provider claim. You must fix the claim and send it back through the system. So we have 2 different systems. Each one requires 2 different actions. So please make sure that you're aware of that. Something else that someone asked me about, and I put it on this slide, can the provider appeal the fee schedule amount? And the answer is no in most cases. Rarely on the physician fee schedule, you will see something that is carrier price. It's got a C in the pricing column, and you can appeal those, right? That'll come back with an MA01 saying, if you don't like how we priced it, ask us, we'll take a look at it again. Also, if there's no MA01 in the remarks code on your remittance advice, not the reason code. The reason code will say there's a financial adjustment, this went to deductible, a variety of other things like that. The MA01 is what we're really looking for. Not appealable is retroactive eligibility. This is a timely filing situation when they become eligible before the time frame to file that claim. Let me give you an example. Someone goes to Social Security and Social Security says, nope, you're not disabled. 3 years later, they say, now you are disabled. Well, then they retroact their Medicare eligibility saying, okay, we're going to go back over a year ago and give you Medicare coverage along with Social Security disability income. That's called retroactive eligibility, except you as a provider had no idea that was going to happen, right? we will allow for that. However, it's not an appeal, and I want you to circle that one because we get so many appeals in for that it stops us from processing actual appeals, and we simply send out a letter saying this isn't the right way to do this. File to the claims manager, etc., and we have an article on our website for that. So please make sure that you're doing the appropriate action on this one. Without that appropriate action, we will automatically dismiss it. And again, couple of reasons for main dismissals. First, the number one is just exclude. Also, retroactive eligibility are our top ones. I do not want you also to exclude or to not look at unprocessable or return to provider claims. At this point, I would like to address a question that was put in about return to provider claims, and this is called T status. As soon as you hear T status, know that this is a UB04 or 837I claim, and it was filed to FIS, the Part A system, which again only processes those two types of claims, but it does also process Part B benefits. So it says, how can a claim appeal be done if it's stuck in T, again, unprocessable, not having a covered diagnosis? And the answer is, we can't do an appeal on this. This is not an appealable issue. It falls into T or return to provider status. We can't do anything with it. So I wanted to bring that just to everyone's attention that not all actions can be done through the appeal status. Another question that came in regarding this information is that they received a request for documentation on a service that is not covered. Why does this happen? This one means someone else filed the appeal. You filed it correctly, you told us it's not covered, we're good with that. But the patient said, I really want you to look at coverage for this, and that's where that falls into being. So when we look at some of these non-appealable issues, remember the patient also has a right to do an appeal. And so if they disagree that we should or should not cover something, that's what will happen. Hopefully that answers those two questions. Again, if not, please feel free to put more in the chat. We'll get more into those later. All right, what else do you need to know? We had a bunch of questions come in. I think people have heard of this, but may not be super familiar with it. One of the questions was, does an amount in controversy apply at all levels of appeal? This slide answers that, and it is no, it is not. So let's start with what an amount in controversy is. This is the disputed amount between what you've received and what you expected to receive. It is not the amount from what you billed for the full amount. So if Medicare made a payment, the amount in controversy will only be the difference between what you received and what you expected to receive. Okay. The amount in controversy only applies to level 3 and 5 appeals. Level 3 and 5. We're going to learn the next levels in the next slide. The amount in controversy is updated annually by the Consumer Price Index. It can go up or it can go down. Let's use an example. In 2024, when you file the appeal at a level 3, you need to have $180 in controversy. But in 2025, it'll be $190. At level 5 in 2024, it's $1,840. But in 2025, it's $1,900. Now, again, it can go down. It's all based on that consumer price index, and it's all based in this magic formula that comes from the federal government. I call it a magic formula because no, I can't explain it, and no, I don't understand it. That's way beyond my realm of something I can do for you. So the amount in controversy, again, it's a dollar amount which applies to level 3 and 5. And here are the 5 levels. Okay, so first is a redetermination done by your Medicare administrative contractor. Second is a reconsideration, which is done by your qualified independent contractor. The graphic on this slide is right. The word reopening should not be there. At this point, it was meant to pop up later, but obviously it's there. Third, a hearing, which is part of the Office of Medicare Hearing and Appeals Decision, OMHA. And if you choose not to do a hearing, we'll talk more about what can happen with that. Fourth is the council's decision, and this is the Medicare Appeals Council review in their decision. And last is a U.S. District Court judicial review, and each one of these has certain time frames. Now, again, if you see reopening on the slide, go ahead and cross that off. The question that I wanted to address is, what is a reopening, and does it actually count as an appeal? No. A reopening is something you can do as a minor error on a claim. It does not count as part of the appeals process. It does not have the same timeframes. It is a separate action. We do offer a separate course on it because it has a lot more information, so I don't want to get too involved with that. Another interesting question that came in regarding this is how long does it take to reach through all of these 5 levels? I'm going to let you know that this can be very time consuming. It can be years in the making. Why? Because each one has a certain time level that applies. And if you're waiting till the end or closer to the end of those time levels, it will take time. And you'll see that as you begin to look through how long we have to do something, plus how long you have to do something, and starting with the first level. So let's talk a little bit more about some of the specifics that go into these different levels of appeal. So first, again, is a redetermination. And this is a decision made by the MAC who processed your claim. So it's a redetermination. And again, your Medicare administrative contractor would be WPS if you are in J5 or J8. It is an independent staff review. That means that no staff that touched it before has the right to touch it again. It has to be a completely separate staff. So it is nice in that way, in that it can't be partial. We get independent staff to look at it. We have a separate nurses. We have a separate set of CMD. If it needs to go to a doctor, everyone has to be independent. Here's where the other question answered and said, how long is the appeals process? So first, you have 120 days to file for an appeal. This 120 days starts on the date of the remittance or the date of the letter. There is no amount in controversy, but we have 60 days to complete it. So if you waited 120 days to file this, and then we got 60 days and it took us 60 days to complete it, how many days are you at already? And think about that. Really think about that. You're at 180 days. Now divide that by 30 days, average length a month, right? How many months are you at that? And you haven't even moved on to level 2. So I did want to make you aware of that and to kind of bring that in as you calculate these different levels. Again, the amount, when it says no amount in controversy, a level 1 appeal could be for something as simple as, I don't agree this should be the patient responsibility, or the presentation just show something different. So that doesn't have, in that case, it doesn't have the dollar amount that goes with it. What it does have is a disagreement over some portion of claims processing. The next question regarding this was, we have 120 days to file. How does Medicare account for mailing? Which is, how does Medicare give you time frame to allow for the USPS, the United States Postal Service, to get us that mail? You can actually add 5 days. So we do give a 5-day grace period to allow for mailing. The next slide should be your reconsideration slide. And as I said, that was where the previous slide had the incorrect information. But a reconsideration is a review by a qualified independent contractor. That contractor is commonly called a QUIC. The QUIC's job is to make sure that we process the claim in accordance with the information that was given to them and the information that was supplied. So we know that the QUIC is looking at what information you gave to us. But keep in mind, they will look at what you asked us to do as well. So if you didn't ask us to consider something, the QUIC also cannot say, hey, we haven't done this, or you haven't asked for this in the proper order. So sometimes that also becomes part of the problem. Did you ask for things in the proper order, and did you ask for the specific requests? We do have more information coming on that in a little bit later in the program. All right. Now the QUIC also does not have a amount in controversy, which means it can be anything you want. I do want to let you know that with this is the last level for submitting new documentation. Things to be aware of with the QUIC and submitting documentation. If you do have new documentation past this second level, it can be submitted, but you must provide a justification statement telling why it was not previously submitted. Okay. So we want to make sure you're aware of that. 60 days to complete this. Awesome. That means that it's 180 days for you to file from the date of the remittance advice, or the letter. And also, then we get 60 days. So think about that. Now, if you're putting all that together, you've had a total of 300 days to file. We've had a total of 120 days to process. That's already over a year. So I want to make it sure that that's going on. And, when we look at those information, Couple of things about the 180 days. Please note, we will not necessarily send you a letter if we overturn your decision. We will issue you new remittance advice. This advice will have new coding on it, new, remittance, remarks and reason codes on it. That date on that advice is what starts the new 180 days. It's not the original one, okay? Also, if we do uphold our decision, we will issue you a letter explaining that, and that letter, the date on that letter allows for the 180 days to start. So when we're looking at the 180 days, that's what it means by that. So hopefully all of that means that will also then apply throughout the next levels that we go to. And I wanted to bring that up because we did have a bunch of questions submitted on that. So hopefully that does answer that for you. So what's next? Well, next we hear us talk about the Office of Medicare Hearings and Appeals. No idea what's going on with my mouse here, so you guys might be able to see a mouse kind of going a little crazy, and I apologize for that. This is a review by the administrative law judge, unless you waive your right, and you can do this. You can actually waive your right and have it done by an attorney adjudicator. Either way, this decision will be made by the Office of Medicare Hearing and Appeals. And you do have to complete a form with this, and you do have to submit it. They do have an electronic option. I do recommend looking at the CMS website. We'll give you that link in a little while. Okay. So things to understand with this one, it is 60 days from the date of the remittance advice following the quick decision or the quick dismissal letter, decision letter. Now, it is an amount in controversy, and we talked about that. This is that first level. So this is that 180 or 190, depending on when you file it. This is not on the claims database. This is based on the date in which the appeal is filed. Also, there was a question asked, does each claim have to meet the amount in controversy? And the answer is no. Here's how that works. If you have a bunch of claims, they do not have to be for the same patient. They do need to be somehow tied to the same group or same provider or something. There has to be some reason that you're filing this as a group. The amount in controversy can be the difference between all of them. You can compile all those together to make that amount in controversy that does change. So I want to make you aware of that. Now, the Office of Medicare Hearings and Appeals does have 90 days to complete their decision. You must wait at least 90 days before doing any further action. We're going to talk about what that action would be depending on the next level. So with that said, it probably sounds pretty familiar, except did you notice that you now get 60 days versus the 120 or the 180? 90 days remain the same. Nothing major changed with those. Now the 90 days and the 60 days will continue to be a theme on the next few levels. And our next level, which is level 4, Medicare Appeals Council. The Medicare Appeals Council is part of the Health and Human Services Department of Appeals Board. So a little bit up. Now this is not a judge, this is not a legal, this is a part of the appeal board. What are they looking at if you go to the Appeals Council? We're looking at the previous level, which again is that appeals board, and does that judge, that attorney adjudicator, that judge have the right to make that decision legally? This is why sometimes they don't consider new documentation. So we want to make sure we have all of that. Okay, so when we look at this, you do get 60 days again to file. And again, you're going to use the remittance advice of the previous letter. There is not an amount in controversy, and the Medicare Appeals Council does have 20 days to complete this. Now, I'm sorry, 20 days? Wow, that's a very short time frame. 90 days to complete. Did you guys catch my error there? It is 90 days. Please make that aware of that in your head. I just wanted you guys to be aware of that. Now, again, they're going to look at it from a different perspective, just like the administrative law judge can look at it from a legal perspective, and we can't. We look at it from what's written in the regulations, the guidance, the policies, etc. That's what we have to follow. An administrative law judge is the first time they can pull out the law, the Social Security Act or other laws, and say, hey, based on this law, you should have processed it in this manner. We disagree with how you did it, do that. Okay, so it's a little bit of a different situation when you hit that level 3, level 4, and then even going on to level 5. Because in level 5, this is going to be our judicial review. Federal District Court. I want you guys to circle that part right there, because while you have 60 days to file, and again, you have the remittance advice or you have the counsel letter, either one, right? One of the things that you have to note is there isn't a set date to complete this. Each judicial review is set into a court docket, and the court docket gets completed whenever it gets completed. So no, I don't have a set time it takes to complete this entire process. As you can see, if you go to all 5 levels, it can take a long time. Please note on this slide, it does say that there is an AIC. This is the higher AIC, the one that was $1,900 for next year. And again, yes, you can combine like things, but please remember that you must use claims that are within the same time frame or an overpayment within the same time frame for filing. You still don't get to go outside of those time frames and suddenly add new things in or put other pieces of information in. That doesn't work. You have to stay within the original request. Okay. Which brings us to the first question that I want to address. And the first question that I would like to address is, what happens if there is a time frame and it's not completed within that time frame? So let's talk about a level 1. You can then write to the qualified independent contractor and ask them to look at the time frame. You're not asking them to do an appeal because the appeal isn't adjudicated at level 1. Instead, what you're asking for is to say this wasn't completed. When you write to them and they look at the time frame, their goal is to simply say, hey, yep, or no, and what they will do then is, if it is not valid, if the time frame wasn't done in time, they will reprimand it or send it back to us to complete that. Okay. Question number 2, and again, put your questions in chat right now while I'm talking so that we can get to those as well, because I'll take those in just a moment. What's the best way to file an appeal? The best way to file an appeal will always be electronically. Now, different levels do have different websites that they use. For instance, ours is WPS www.wpsgha.com. I want you to note that the MED portion of that has now been removed. We are no longer using a temporary site. Our website address is www.wpsgha.com. If you continue to try to use that MED portion, that will go away. So please make sure that you're filing electronically if you can. This is the best way to actually do this. Yes, it does allow you, and the Medicare systems, the Medicare processing manual, does allow you to file for an appeal. That's great. It can be filed in paper. It also states you don't have to have a specific type of request, but you do have to have specific information. This is in the Medicare Claims Processing Manual, Chapter 29, which is the appeals of claims decision, and it's in Section 310. I'm going to have a couple of things put into the chat for you. 1, the appeals form. 2, if you want some more information or you want more information on locating what I just read out to you, Karen's going to give you a link down in the chat for that. Okay. If again you I'm sorry, again, the next question that I'd like to address is, what records are needed? Well, first of all, can you tell me why you're filing the appeal? Because that's going to determine whether or not we even need records. So if you say to me, I'm filing an appeal because this wasn't processed correctly because I submitted the wrong thing, well, I'm just going to change that information. I don't need to do that. If you're saying, I'm going to file an appeal for timely filing, that's great, but that's not going to be an appeal. Okay. Different set, don't need records, need to use the proper process. If you're saying I'm filing it for medical necessity, then yes, we need your full medical record. Here's what we don't need. Something that was not known at the time of service. It does not prove medical necessity. Okay. Once those records are received, they will be passed on to each level. So I can't say specifically what records are needed because I really need you to go back and look at what you're actually doing, and that would answer that question. Okay, I'm going to give myself just a second here, take a drink of water. Karen, do we have any questions?
Hi, Tom. We did have a question come in through the chat. Once the claim denies for medical necessity, can we submit a corrected claim with a better diagnosis, or do we have to file an appeal?
So if a claim denies for medical necessity and you do want to submit a claim with a different diagnosis, yes, you can do that. That's a resubmission of a claim. There are ways you can do it for more than one action. You could do a clerical error reopening if you have UB04 837I access, which would be FIS through direct data entry. You can do a corrected claim in there sometimes. So a variety of different actions, but yes, I do want to let you know that yes, if that stands denied, go ahead and if you're submitting on a 1500 or 837 Ps, you definitely can submit a new claim. Next question.
Okay, that's all the questions we have had come in. oh wait, I'm sorry, one more. Once a reconsideration is completed and approved, can we make any changes to that claim? For an example, adding a modifier through WPS, or does it have to go through the QIC?
So once it's been, once it's been at that level, and if you just want to make something simple like that, you will get a reprocessed claim. You could still do a clerical error reopening, which I'm going to guess, or a DDE correction, just because you've gone up to the quick, you can still fix it. So if you recognize that a modifier needs to be added and you don't want to go on to the next level, as long as you're within the time frame to allow for those. Now keep in mind, a clerical error gives you 1 year versus the 120 days and the 180 days and all of that. So you do have to be within that time frame, and I want to make that about as clear as possible. But at the same time, if you submitted it and we know the change has been done, we know that it's been approved, you do have to move through the process if that's not going to give you a different action or something else to go on. So sometimes what's going to happen is you'll go in and you'll correct the original claim. We'll get the information from the quick and we'll make a change too, and then all of a sudden you're going to get a duplicate out somewhere along the way, and it's going to cause some other problems. I'm not saying you can't do it. I'm just saying it might not always be the best option, just depending on the actions that you want to take. And it's very hard, again, to speculate on that one because different actions and different items will cause different reactions, as you can imagine with the system edits and audits. Karen, any other questions?
That's all we've had at this time.
All right, so what's the next area that we're going to talk about? And we're going to talk about some tips. Now, these are the things that we, when we look at what we're talking about here, is tips coming from level 1. Now, keep in mind, why don't I give you tips from all of the levels? Well, I don't necessarily have them. So level 1 is what we work with. And remember, we talked about that. So, all right, let's start with the first tip coming from level 1 that's causing issues. Be specific for the reason, and make sure the reason applies to what you're actually asking us to look at. So this is something I would like to offer for Bridge. Start with detailed information. Are you trying to appeal a claim or an overpayment? This is a common problem for dismissals. People will say, I don't agree with your claim decision. Well, it wasn't the claim decision that you didn't agree with. It's the fact that we're taking the money back, which is an overpayment appeal. Though handled by the same department, we can only look at what you ask us to look at. All right. We get things saying, here's an appeal for medical necessity. And we're like, but we didn't find this wasn't medically necessary. We said it was a duplicate. There's nothing about medical necessity within this. So when you're trying to appeal it for medical necessity, that's not even what the claim denial was for. This can cause a dismissal. So read your decision, read the original decision, and write to that. Don't just automatically stamp things. Don't have forms laid out. Don't just automatically do something. Medical necessity denials, appealing without the documentation, doesn't help us. But also, signatures are part of documentation. Did everyone catch that? From the appeals request signature down to the signature on the medical records, down to the signature on the order. These are all part of documentation and must be submitted. That's where some of the missing documentation comes in. One of the other ones that is commonly left off for missing documentation is the order. You're submitting something and saying, yes, we feel like this should have been inpatient or observation. I don't have an order to even consider that. That will not be considered for medical necessity. We won't even look at any of that. We won't consider it for proper coding. We won't consider it for proper payment because we don't have the order. We have a lab order, but the lab order isn't included. So you did a lab, but why did you do it? Even a standing order or something that would require that. Give us that information. Also, do you disagree with the allowed amount for something? Hey, this should have been this allowed amount because it should have been 3 units of service billed at this, which should give us this amount versus the way you processed it. Okay, be specific. Also, when you're looking at the levels above a level 1, one of the things that we have gotten from them is to please explain why the previous level failed to complete timely, or what's going on with the previous level. I disagree with the decision at level 1. Here's the documentation to support that. See section 4 on page 26, just as an example. You're helping them understand what they should be looking at and what they should be going through. Now, if you say it's a medical necessity denial and you say we feel this is medically necessary, there are 12 pages of documentation. And if you look at page 6, blah, blah, that will help us tailor into what you're looking at. So when we look at this, one, Specific verbiage does count, and be as clear as you can. I don't know how to make that any more of a tip other than to please make sure that you're doing what you need to do there and that everything comes through in that manner. All right. Next, please stop skipping levels. This sounds very, very basic, but it is one of the primary reasons for dismissals. It's one of the primary reasons that the quick dismisses is that you didn't complete a level 1 or you're not referencing a level 1, so they can't tell that you did it. Same thing for us. Like, we'll get all kinds of requests, but it'll be for the quick. Well, I can't do a reconsideration. I can forward them on, right? Our appeals department can forward them on if everything is met. Here's the problem with forwarding it on. What if they don't get it in time? Well, that's not on us. You sent it to the wrong level. You didn't file it in time. So now it's going to be dismissed timely filing. So when you look at it, one of the big things that we see overall with this one is incorrectly filed order. And that could be, you know, up, down, or whatever. So don't skip levels. One of the next issues that we were asked about, and it's not, I guess, not really an issue, but just kind of a tip, is to make sure that you allow for mailing time. Remember, 120 days, 180 days, 90 days, all of those things are when we have to have it received, okay? So please take a minute, look at it and say, I have this date or I have this letter, all of those, and make sure that you allow it enough time for timely filing. We continue to dismiss a lot of these for timely filing. In terms of us at 120 days and us being your level 1 done by the Medicare administrative contractor, we do have a calculator out there that might help you. I've given you a link on here and I put a display on the screen. It's not anything major, it just might help you a little bit, where you can actually put the date in there and then it'll tell you what the date is that you have to file by. Okay. Remember, we have to have it by then, not any other way around. Next tip, to make sure that you submit all supporting documentation. That is new. Now remember, if you submit documentation at level 2, we will be asked at level 1, what do we have, what do we consider? So yes, we do have to forward that. So if it's already been submitted, you may not necessarily want to submit it. Sometimes it gets confusing over what has and what has not been submitted. One of the things that happens is you submit new documentation at 3, 4, or 5 without justifying wasn't submitted previously. Remember, I mentioned this before. You have to include a statement indicating why they should consider this when it was not previously sent. Also, stop sending unnecessary documentation. Signatures are necessary. Information from data service is necessary. Information from previous records referenced during that data service is necessary. However, if you're telling me that an ambulance run took them to the ER and you are sending an ER discharge summary, how is that ER discharge summary known to the EMT, known to the treating person at the time of transport? It wasn't. That can't be considered because you have to know it to count it. If you're saying, hey, I did this, and you're sending me orders that were ordered 4 days later for a test to prove that this was medically necessary and why you did this 4 days ago, that doesn't work. And for those of you that say, hey, where'd he get that one? That's a real example. A doctor did some treatments, a variety of treatments. They said, hey, it has to be supported in certain types of care. And so then 4 days after that, they ordered the test that would have supported the treatment had it been done. Okay, well, we're not going to pay for that because this test was not done and not completed and the doctor didn't have the results until 4 days later. Yes, his hypothesis is good, but we still had to have that supporting documentation. So hopefully all of that kind of works together. If you have more questions on that, again, please let me know. But again, does every action or appeal need to have documentation? And the answer is no. It depends on the action you're taking. Next tip is check your eligibility and primary payer information. This is actually coming from a couple of questions that you guys did ask me. The question really about this one was, what happens if it processed and denied? So we went ahead and did an appeal, but then the eligibility changes during that time frame. And that can happen. The appeal can be dismissed for that because the patient eligibility is different and we can't process the claim. The appeal could also be something where it gives you a different denial, such as patients no longer eligible. So instead of giving you what you expected back, it's going to give you a completely different denial. So do check and make sure that they're still eligible for Part A and B. that they have railroad Medicare versus traditional Medicare, that they don't have a Part A plan, and also that they're not inpatient at the time. Keep in mind, we say inpatient because hospitals do not bill in the same cycle as outpatient services, such as professional services. So you can actually file a claim, get a denial for it in 14 days, file the appeal in 17 days, and that's still within the 30-day window for a hospital in which they don't file their first claim. So it comes back, we go to open that appeal, and now we see an inpatient stay is in place, and that claim should have been filed to the hospital. That is what we're talking about when we talk about all of this. Also, along with that, we talk about primary payer information. And the reason that we talk about primary payer information is because primary payer is something that has to be done beforehand, and Medicare requires the investigation of it. So we can't pay if it's got a primary payer information. So if someone puts on the claim that there's primary payer and we're having some issues with it, or we have to look at it further, that's great, but we can't pay that claim. So we know in the future, we're going to stop all claims payments, which would include your appeal payment for primary payer information. So again, check those different systems, make sure that you're looking at that different information. All right, I did talk a little bit about this one, but just to reiterate, a reopening is not an appeal. A reopening is not a level 1 appeal. A reopening is an action taken. The action taken is considered for a minor clerical error or a minor item. So such things as, the initial determination wasn't done and now you want to add a modifier. That could be a reopening depending on the situation. So there's a variety of different types of things you can do. One of the things that has come up is medical records. Is that really a reopening, or is that really a, is that, well, you file it through the appeals process, but if you're submitting documentation that has not been looked at before and it was denied because of medical records, saying, hey, we didn't have any, then it does become a reopening and you do get up to 120 days. So hopefully that makes a little bit more sense. Now, a reopening, again, we do recommend that if you're just putting a modifier or you miss some piece of information, we really do recommend that you take a time and just go through that process, I guess, is what we'll say there. All right. The next slide is a space holder again, and you guys will be familiar with this one. And this is your tips and tricks slides. So I'm going to go through some pre-submitted stuff, and then what we'll do is jump back and we'll take any submitted questions that you guys have in the chat, and then we'll go on from there. All right, so first, how can I have Medicare review an NOC charge or a non-payable Medicare code on the UBO for method 2 billing? So they are different separate processes. An NOC charge typically will come back if it is adjudicated and everything else works correctly on the claim, which means we have the information to process it in the first place. Many of the NOC charges that we get, we don't have the proper information and we're not going to look at those in appeal. We're going to ask you for more information and we're going to say send this in. Okay, so an NOC charge can be appealed. You don't agree with how we paid it, things like that, because an NOC charge is a not otherwise classified code. It is something that is contractor price, so we want to make sure you're aware of that. Now, a non-payable Medicare code is not something that we will typically look at. Non-payable means it's excluded in the law, and that's not part of the appeals process. Now, a patient could file for a non-payable code should they disagree, but it has to be their signature or their information on there, or they have to have an appointment of representative form allowing for you to file on their behalf. So hopefully that answers that question. The next one was an interesting one. I'm going to give you two different answers to this question. Is appealing twice successful? Well, no, appealing twice for the same level will never be successful. This will be dismissed as a duplicate appeal. So don't do that. But if you mean, is moving to the second one successful? Yes. Here's the thing. Each level is looked at a little bit differently, and sometimes when you look at level 1 and 2, we're following the same regulations and guidelines. We're following the same LCDs, the same NCDs, the same policies, the same everything. So therefore, it's not as successful as you would want it to be. However, on level 3, what do? Level 3 looks at it from a different legal standpoint, and so sometimes those are more successful than a level 1 and 2. So I wasn't really sure which way you wanted that. How to help you outsource billers file appeals. Well, this runs into a whole lot more spectrum. So I will tell you, we don't typically talk about outsourced billers because When they file the appeal, it does have certain things they still need. It does not change any of our tips. It doesn't change the information we need. It doesn't change how we process a claim. So if you're choosing to use one, each one is done differently. And I don't know how your outsourced area functions. So I can't really give you a lot of advice on this because I'm not sure what you do within your organization, and that becomes part of the problem for us to give generic advice on this. The next question is one portal that works to manage all appeals. The answer is no. Each level has their own portal. So Quick has their portal. We have our portal for a level 1. ALJ has their portal. Everybody has different portals. There's not one that you would go to manage. And it even goes further to say each MAC that processed a claim, their own portal. So this can be a little bit confusing. So no, there's not one that you would go to. What is the most common reason for a level 1 appeal? And honestly, the most common reason is for a valid medical necessity. Now I say valid because obviously there are other things that are not considered valid appeals and cause automatic dismissals. But in terms of a valid appeal, it is medical necessity. When we run into a hard edit, but the services are clearly documented as unrelated, do we have grounds for appeals, and how do we do this? Well, a hard edit is an interesting one because a hard edit can be an unprocessable, it can be an RTP, it can be something that denies a claim, it can be a variety of other factors such as a bundling edit. So I was really unsure what you meant by hard edit. I will let you know that if it's a hard edit and it does allow appeal rights, you do want to look for the MA01 and the remarks codes and making sure that that's there. I'm not really sure what else you mean by hard edit, so just please be aware of that. All right, how to correct a claim. I've gone through this a couple of different times. Correcting a claim is not necessarily an appeals process. In MCS, you can use the clerical error reopening, also known as the reopening feature. You could also submit a new claim. This will correct your claim. In FIS, now MCS processes, again, MCS is 1500 claim forms or 837P. FIS is UB04 or 837Is. And in order to correct a claim, yes, you can do a clerical error reopening. You can actually enter the system and correct it through DTE. You can also send a new claim. So it really depends on what's going on with that claim. And I don't have much more of an answer than that. Observation appeals, I don't really know what you mean by observation appeals. If you're appealing whether it's observation or not, and you're appealing whether or not we overturned it, whatever, we do need the orders. That's going to be your primary thing with that. Was it ordered into observation? Was it something pushed into observation due to maybe a review committee, or what's going on with it? And you want to make sure you give us every piece of information you can. Also, tell me why it was denied and are you appealing for that? All right. MUE denials, are they appealable? Yes, they are appealable. Now, CMS does list some MUEs on their website, and there's also more MUEs than that. Here's the thing. We will deny the entire line item data service, or a line item for an MUE. That is how CMS expects us to process the claim. Once that line denies, if you have a medical need for more than whatever that is, or you have a medical need to support the level, you want to do an appeal on that, and you want to send that in, and you want to make sure that we have all of that. So you want to make sure you have the information needed. All right, I'm going to stop here and we're going to jump back to Karen. Karen, any questions?
Tom, we have gotten some questions that have come through in the chat, but I don't know if for time's sake, if you want to respond to those later, or if you want me to go ahead and read them.
I'll try to take like maybe just one or two and then I'll go on. I don't have a ton of time, so yeah, just one or two.
Okay, I'll kind of combine some of what came in. When submitting, I'm sorry, I'm trying to get back up to it. When submitting appeals, do they need to provide like, do they require ENCODE or NCCI edits, policies in full, links, or resources as to why they could disagree with the denial?
So we always recommend that you, if it's a policy or if it's a CCI editor or whatever, we always recommend that you include that information in a written format. It doesn't have to be real specific information. Links are awesome, especially if you have it. You can say per this policy. Please keep in mind that when you cite a policy, it needs to be an NCD or a local coverage determination covered by WPS. It cannot be some other contractor's policy. Unless that policy has specific italicized verbiage, that italicized verbiage is considered CMS verbiage. So it is always good to include it. It's always good to include that explanation. However, it's not always going to give you the result that you want. I'll take one more, I guess, Karen.
Okay. Catherine said her question was addressed, but what she's wanting to know is how we even get the claim ruled on without being returned via RTP for the NOC codes.
Okay, Catherine. So this one's going to be a little bit more complex than that. And the reason that I'm saying that is because it depends on the NOC code and the information that's on the claim. So each claim, we do have to look for certain key pieces of information and development reasons. And there's certain coding information. You can imagine the narrative fields are used for this. So you have to take each claim if it does, and you have to go back to customer service. They have to look at it, see what's there, see what's not, see what's missing. So I can't give you a general answer other than you have to take the individual claim number and contact customer service. Karen, that's going to be my last question just because I don't have any more time. So we're going to go ahead and go through the rest of the slides here quick. Couple of resources. Now, I will tell you again, as I said, in order to answer your questions, I did move away from these, but these resources are just going to give you everything you need to know. I did mention the Social Security Act. Here's the sections that work with appeals and work with the different reopenings and all those different things. If you want to know a bit more about that information, you can then move to the Code of Federal Regulations. This will give you a lot of information. It's the interpretation that we follow. Next, just some manual references. I like these manual references because they're going to give you the official CMS information. Next, just some CMS websites. The first one is the General Appeals information. It's great. The booklet that's displayed is the second one, going to give you a lot of information there. Then you got some WPS stuff just for you. Take different pieces of resources. I've covered everything there is, but I also like Karen give you some of these different items. So just be aware that they're out there for you. All right, we're gonna go ahead and keep going here. Be aware that the interactive voice response is going away for eligibility checks. This will happen on January 1st, 2025, and you will still have access to our other eligibility information. So just be aware of that. If you have proof of and the proof of attendance is going to look like this. It's an email that's going to come out. You can see the circled area on the bottom for your certificates. Don't just delete it, check it out. If you have follow-up questions, we'll take those for the next 7 days. You can email those into us. Please make sure that you do have the today's subject or today's title in the subject line. So we'll take those. Last, we're going to ask you to take a survey. And again, that survey link will be provided for you. It's going to be in the follow-up email. Just give us your good, your bad, and your ugly, and what you think we did well. With that said, that brings us to the end of this webinar. Thanks everyone for attending. I hope that you have a great day.